It's my pleasure to introduce our presenters. One of our presenters is Dr. Melanie Dirks, and she's a clinical psychologist who earned her PhD at Yale University and completed her clinical internship at the Institute for Juvenile Research in the University of Illinois at Chicago. She completed a postdoc fellowship at the Offord Center for Child Studies at McMaster University before joining the Department of Psychology at McGill. She was a full professor and was promoted to one in 2019. Her research examined the skills that youth require to develop and maintain high quality interpersonal relationships and the associations between interpersonal functioning and psychopathology. Our second presenter is Dr. Alexa Martin-Storey, and you may remember that she's presented once before, and we're grateful for her knowledge and expertise. She's a Canada Research Chair in Stigma and Psychosocial Development at the Université de Sherbrooke. She's fascinated by the ways in which youth, and particularly sexual and gender minority identities, survive and frequently thrive despite the obstacles that they experience. Her work focuses on social context, often examining how relationships with neighborhoods, peers, and romantic partners shape adolescence and young adult outcomes. Really delighted to have these two amazing young I'm saying you're young women with us today who are role models and leaders in their field. And I'm sure you will learn as much from listening to them talk as I do every time I interact with them. So over to you.
Thank you so much. So I'm going to do what I always feel is the high wire act of attempting to share my screen. So here we go. Okay, so we should be. Okay, so Alexa and I are delighted to be here today and to talk to you about adolescents and COVID-19, and in particular to have a chance to tell you about some of the work that we've had a chance to do with Dr. Craig, which is, as we're really excited about. So just to give you a sense of what we're going to do over the next hour or so, we're going to tangle with two really big questions. So the first is, how are adolescents shaping COVID-19? What do we know about how adolescents are taking steps to protect themselves and others from transmission, and how they might be contributing to the escalation of the pandemic? And then the second question we're going to tangle is, how is COVID-19 shaping adolescents? What we're experiencing now, I think, is the most profound shift in adolescent social lives, certainly that I've seen in my lifetime, that I expect that we will ever see. So it's really just striking how very quickly everything was different for adolescents completely. And so this is obviously going to have a profound impact on their relationships and their well-being. And we don't have a lot of data from what I think of as the before times to help us understand this, because it is such an unusual experience that we're living history right now. So to give you an overview, we're going to start by talking about understanding adolescents' adherence to COVID-19 guidelines. And then we'll flip the question and we'll think about adolescent well-being and COVID-19. And we'll talk about the idea that there are really profound variations in adolescents' vulnerability to the impact of COVID-19. It is not the same pandemic for everyone. We'll talk a little bit about what's known so far about links between COVID-19 and mental health and well-being, and then we'll wrap up by thinking about how COVID-19 may be impacting adolescents' relationships and how that will certainly present risks, but we'll also highlight a little bit how for some adolescents this may actually be an opportunity to strengthen relationships, particularly with siblings and with parents. So I'm going to turn it over to Alexa to get us going, and I'm going to attempt to move the slide deck for her. Full disclosure, we did not rehearse the part where I moved the slides for her, so just forgive us if we're a little bit turbulent here.
Thank you so much, Melanie. It's really great to be with all of you today. Thank you so much for Wendy and PREVNet for inviting us to do this presentation. So I'm going to start a little bit by talking about adolescents and COVID-19 guideline adherence. And slide. And one of the reasons that we really wanted to start in terms of talking about guideline adherence is because in terms of the tsunami of information that we've received about adolescents during the time of COVID, one of the real common themes that you see in a lot of the media coverage is the role of adolescents in spreading COVID-19. So we're seeing a lot of headlines in terms of either talking about activities that adolescents are engaging as so-called super spreader events, or the roles of individual adolescents in terms of transmitting the virus to a bunch of other people. So next. So in terms of understanding why people tend to be focused on adolescents and their role as transmitters of COVID-19, there was a study earlier on in the pandemic that was done in South Korea that showed that adolescents and pre-adolescents in particular were responsible for a disproportionate amount of COVID-19 spread. And one of the things that I think is going to come up again and again in this presentation is with the novelty of the COVID-19 and COVID-19's impact on the world, we really are in a state of evolution in terms of the kinds of information that we have about this disease. So this was a pretty well done study, but a more recent research done in contexts that would be closer to Canada would suggest that while adolescents can transmit the disease, if you were to look at which age groups are disproportionately associated with COVID-19 transmission, it really does seem to be adults and particularly young adults. So we were really interested in digging into a little bit and talking about, well, why do we think of adolescents as being potential super spreaders? And I think part of that reflects how when we talk about the consequences of COVID-19 for adolescents, there's all of the impact of COVID-19 and the guidelines on their outcomes. But in terms of how COVID impacts them, you see lower rates of serious illness or hospitalization or death among adolescents. So I think that's really pushed to focus more on, well, how are they transmitting it? And I also think that a lot of the discussion around whether adolescents are adhering to COVID guidelines has to do with a lot of our sort of negative stereotypes and stigma around adolescents as a group of individuals who are particularly bad at following rules and more likely to engage irresponsibly. So we wanted to underscore our discussion of adherence among adolescents with the idea that maybe they are not the main source of problems in terms of COVID-19 spread. But I think at the same time, it is important to acknowledge that adolescents can transmit COVID-19 and that there are some adolescents who do experience pretty serious outcomes as a result of being infected with COVID-19. And so it is important to understand a little bit more about their guideline adherence. So in terms of the next slide, so we're going to talk a little bit about what we know about guideline adherence in a Canadian context. So starting with a study that I did with some colleagues of mine at the University of Sherbrooke, we looked at a group of of young people, sort of ages 17 to 22. And the thing that's very important when looking at their rates of adherence is this is a group of youth of whom about half had pretty serious histories of conduct problems. So this is a group of individuals who by and large are much less good at following rules when compared to the population in general. And even when we looked at the rates of adherence among this population, it was still the majority of youth who were reporting always washing their hands when coming into contact with new people, covering their mouths when they're sneezing or coughing, not spending time inside with people who weren't members of their household, and not attending parties. So even this group of individuals who are at higher risk for not following rules, we're seeing more than half are typically following most of the rules that we ask them about. And in terms of another study so this is the study that was done by PREVNet, looking at adolescents from all across Canada. And this was done a little bit later on in the pandemic, so between August and October, when we had a little bit more information about the importance of some certain activities like mask wearing compared to others, such as, say, sanitizing groceries. And what we see is even within this sample, the majority of youth reported engaging in more health behaviors than they had prior to the pandemic. And one of the things that we saw pretty consistency was that being older, so being closer to that 18 rather than that 14, was associated with more compliance with COVID-19 related behaviors. So in terms of talking about COVID-19 guideline adherence, it's kind of useful to think about, well, what generally encourages adolescents to adhere to COVID-19 guidelines, and then also more specifically, maybe what do we know about youth for whom it's a little bit more difficult for them to follow guidelines. So in general, research with adolescents, and there's not a lot of this research out here yet, so you may have seen some this is very much an evolving literature, but things like belief in the self-efficacy of following guidelines, so believing that guidelines work and that an individual is capable of adhering to guidelines, belief in the benefit of following guidelines, and understanding of the perceived severity of COVID-19 are all things that are associated with higher likelihood of following COVID guidelines among adolescents. We know that lower feelings of trust in government is associated with lower compliance with COVID-19 guidelines. So in terms of thinking about different kinds of youth's experience with institutions and their trust of those institutions, that's going to be important. And then finally, as is almost always the case with adolescents, social norms are going to be really important in terms of determining adherence. So you perceiving that guideline adherence is a broader social norm is going to be really important in terms of supporting adolescents' adherence more generally. Now, next slide. And so we're also specifically interested in understanding, well, we have this sort of general idea of the factors associated with guideline adherence, but we also know that there are specific youth who have more difficulty following rules. And one of these groups of youth are youth with conduct problems. So these are behavioral difficulties that are associated with opposition and noncompliance and are generally sort of associated with rule breaking more generally. And a study that is just about to be published that I did with my colleagues at Sherbrooke, we showed that conduct problems, so these sorts of problems, are associated with COVID-19 guideline adherence, which would suggest that following rules about COVID are associated with some of the same factors that are associated with following rules more generally. And in terms of explaining why these kids with with conduct problems were less likely to follow guidelines, we really found two factors that explain this difference. And the first was callous unemotional traits. So these are traits where an individual cares less about sort of the feelings and the well-being of others, and we also, which are higher among youth with conduct problems. So that was associated with lower guideline adherence, as was higher levels of substance use. So in terms of thinking about addressing the needs of this group of individuals in particular, so youth with conduct problems or youth with problems in terms of following rules generally, well, in general, providing accurate information about the efficacy and benefits of following guidelines may be important for adolescents. When we're thinking about youth who are particularly bad at following rules, it might be useful to take more the kinds of approaches that you see in other behavioral interventions for youth high in callous unemotional traits, and focus more on trying to get youth to see the advantages of them of not being people who transmit the disease. So, and just to sort of wrap this up with a discussion of some of the work that's been looking at factors that are associated with promoting adherence more generally. One of the things that some more recent research has shown is that in general, while providing people information is important, really contextualizing that information and providing them specific examples about how their behaviors could lead to harm in others is important. So this was, oh, no problem, Dylan. I'm a very fast speaker, I apologize for that. So one of the things that that might be considered worth thinking about are posters more like the poster, I want to say, the poster with the pictures of people in it. Because this is a poster that really illustrates how a youth's specific behavior is going to infect people around them versus these more general posters about sort of keeping your distance. And so they found that these sort of more specific behavior-driven posters in terms of the consequences within a general sample were associated with higher levels of compliance. So that kind of gives you an overview of some of the issues around adolescents and COVID-19 guideline adherence. Now we're going to switch it up a little bit and talk about more for the rest of the presentation about how COVID-19 is impacting adolescents. And while there has been a lot of coverage about the role of adolescents and spreading COVID-19, one of the things that's pretty clear and becomes clearer the longer this pandemic wears on is that we're particularly concerned about the impact of COVID-19 on adolescents' mental health. So we're seeing a lot of concern around mental health service usage, around suicidality, around depression, around these sorts of issues. And one of the things that when Melanie and I were talking about sort of the kind of information that we wanted to present today, one of the things that we felt was really important was in talking about how, while we talk about the impact of the pandemic on adolescents, and while most of the research that exists sort of up until now looks at adolescents more generally. There's enough existing research, both in terms of what we knew about certain groups of teen before and how we think that the pandemic is impacting teens more generally, that makes us think that certain specific groups need to be addressed specifically. So I'm just going to contextualize some factors that might be associated with specific vulnerability right now. And the three major sort of vulnerability factors that we talked about were the role of socioeconomic status or wealth, the role of racialization, and the role of sexual and gender minority status. So starting with socioeconomically vulnerable youth, this would be youth who are vulnerable due to the resources that they have or the resources available in their families. And when we talk about socioeconomic vulnerability, we're talking about a whole range of youth. So these are youth who might be without housing or are in precarious housing situations, either because their whole family is in this situation with them, or because they've been pushed out of their family. We could also be talking about youth whose families were experiencing socioeconomic difficulties prior to the COVID-19 pandemic, and we would expect COVID-19 to exacerbate some of those problems. And then we also have a group of youth whose families are experiencing socioeconomic difficulties as a result of the COVID-19 pandemic. And one of the things that we found in the data collection done by PREVNet is that youth who report their families as being less wealthy were reporting more lower levels of coping in terms of in response to the COVID-19 pandemic. So in terms of thinking about some of the ways in which these youth might be particularly vulnerable in terms of the COVID-19 pandemic, next slide. We can identify some specific barriers for lower income families and lower income adolescents in this period. We know that, for example, the COVID-19 pandemic and the impact on the individual is going to be based on the kind of resources a family or an individual has for social distancing. So housing situation is going to really have a strong impact on, for example, space for learning, the ability to be in a different room from other members of your household, the ability to use outdoor space that is not common space, depending on the kind of restrictions in your area. This has specific implications in terms of education, where higher resources or more youth with access to more resources are going to have a little less difficulty in terms of at-home learning, just in terms of screens, internet availability in the house, ability to learn in a quiet place, sort of that's more free from distractions. We know that while regardless of that level of contact varies widely by type of job and types of income associated with those jobs, a lot of the jobs with lower income involve more contact with other people. So in the youth who have family members who work in a sort of a lot more front-facing types of jobs are going to experience more difficulty during this time. And then we also know that for a lot of low-income youth, they're very dependent on services around meals, around mental health services, et cetera, that they're going to be receiving from the school environment. And that's going to be much more challenging in times where youth are not going to schools. A second group that we think is really important in terms of thinking about the specific impact of the COVID-19 context is racialized youth. So who I'm talking about when I'm talking about racialized youth are youth whose ethnic background causes them to be identified as non-white. In Canada, we frequently use the term visible minority group youth. This obviously captures a large range of youth with a large range of issues, but I think there's just some pre-COVID barriers that might be particularly important to understanding the lived experience of these youth during COVID-19. So, for example, we know that experiences of racism and discrimination have consequences for health. And a lot of those health consequences are going to manifest in terms of pre-existing conditions, which are going to make youth and their families more vulnerable to the health impact of COVID-19. We know that there's a racial wage gap in Canada. And so when we're thinking about all of the barriers faced by youth experiencing socioeconomic difficulties, a lot of that's going to also impact various groups of racialized youth. We know that immigration and immigration status we see more new Canadians among racialized youth, either their parents or they themselves. So that can be a complicator in light of the COVID-19 pandemic. And then this specifically in terms of talking about infrastructure, we know that in a lot of Indigenous communities, especially Indigenous communities in Canada's north, prior to COVID, there was already a problem in terms of access to online infrastructure, which is going to impact the ability for schools to go online in those areas. And so in terms of thinking about the complications for racialized youth post-COVID, Evans and Francis, for example, and talking about the experiences of Black youth in Canada in particular, talk about as we see an increased surveillance, police surveillance around certain kinds of COVID activity, that's probably going to disproportionately impact Black youth and perhaps Indigenous youth who are already surveilled at higher rates than by the police compared to white youth. We know that a lot of youth play an important role in terms of language and cultural translators in families who have language barriers in terms of English or French. And given the volume, the rapidity, and the amount of new information coming in around COVID-19, that's an important stressor to think about for adolescents. We need to think about how pre-existing stressors around medical vulnerability are going to be impacting these communities, as well as pre-existing inequalities in terms of resource ability. And then finally, difficulty engaging in online learning, especially among individuals who live in communities with limited internet access. And then the final vulnerable group that we're going to talk about today is sort of two groups, but it's gender and sexual minority youth. So when I say gender minority youth, I mean individuals whose gender identity differs from their sex assigned at birth. And sexual minority youth are youth with non-heterosexual identities. So those are identities like gay or lesbian or bisexual, or who report non-heterosexual and sexual and romantic interests. And in the pre-COVID context, we know that this is a group of youth, these are groups of youth who experience lower levels of family support. And one of the really important ways that they have for compensating for that family support is by seeking meaningful relationships and building their own sort of found families outside of their families. So in the subsequent COVID context, one of the things that's, next slide, please. One of the things that's important to think about is how COVID concerns are going to exacerbate pre-existing issues around housing security. So, for example, we know that gender and sexual minority youth experience houselessness at much higher rates than their heterosexual and cisgender peers. This is obviously going to be exacerbated by COVID-19. We know that with a lot of the public health guidelines, these youth are going to have fewer opportunities in terms of connecting with community. It's going to limit their access to mental health and access to mental health services. So we've seen some qualitative work with these youth already about concerns around privacy in terms of accessing mental health when they're surrounded by the rest of their families. For gender minority youth in particular, COVID-19 restrictions are going to limit access to identity affirming medical services. And then from this sort of emerging qualitative literature, we're just seeing a lot of youth reporting the stress of being stuck in a situation with family members that they see as fundamentally unsupportive. So there's probably a whole bunch more. There are a lot of other ways, youth with learning disabilities, youth with other kinds of health problems that are going to be experiencing having a specific pandemic experience, but those are just three broad groups that we thought would be, and broad and overlapping groups that we thought might be pertinent to discuss today. So in terms of so turning back now to this more general picture of mental health, one of the things that we know is that there's a couple of different signs that show that these concerns about adolescent mental health are pretty well founded. In terms of use of helpline, one of the things that the Kids Health Phone has noted is that they have a little more than twice the number of calls in 2020 compared to 2019. So that suggests more kids are looking for help. In terms of, and then another way that we can see that youth are reporting difficulties is that there's starting to be some more work on how youth are perceiving change in their mental health from prior to the COVID pandemic to now. So just have a look at the next slide. This is some work that was done at Sick Kids, looking at how youth perceive their symptom change from prior to the pandemic to now. And you can note that youth were reporting worsening depression, worsening irritability, and worsening attention compared to before the pandemic. We also see differences in substance use. Next slide. But in the case of substance use, what we're actually seeing is youth reporting lower levels of substance use than prior to the pandemic. So they perceive themselves as engaging in less binge drinking, less cannabis use, and less vaping. But that really makes a lot of sense when we think about the kind of context in which these kind of youth are typically engaging in these kinds of behaviors. So if they're spending less time in social context, they're probably going to be spending less time engaging in these kinds of behaviors. Finally, a little tiny bit of information is starting to get out in terms of measuring mental health before and after the pandemic. So this is a study that was done in Australia, and it showed that compared to prior to the pandemic, youth were reporting higher levels of anxiety symptoms, higher levels of depressive symptoms, and lower levels of life satisfaction. So more broadly, in terms of understanding, well, why are youth experiencing these problems and what can we do about it? I think it's important for us to think about change in how youth are experiencing the COVID-19 pandemic. And we know from research that we're seeing huge changes in terms of mobility, huge changes in terms of exercising and other life patterns. But as Melanie's going to talk about in more detail now, one of the big differences we're seeing is in terms of how youth are spending time with their families. And that's what we're going to talk about for the rest of the presentation.
Okay, so as Alexa just said, one of the major changes that has happened as a result of COVID is actually with whom adolescents are spending their time. So normatively, adolescence is a time in which we see increasing amounts of time spent with peers and increasingly less amounts of time spent with family. And that is a totally normative developmental trend. So that is exactly what you'd expect to see as they move to being autonomous young adults. And so when we think about adolescent relationships, we can think of them in 4 different categories. So we can think about the relationships that adolescents have with their parents, the relationships that adolescents have with their siblings, the relationships that adolescents have with their friends, and then a significant number of adolescents will have romantic partners. And this will be when they first start having romantic or intimate relationships. And so, as I said, adolescence normatively is a time in which youth are spending increasing amounts of time with friends and romantic partners and increasingly less time with parents and siblings. But the pandemic and the restrictions that are in place because of the pandemic may fundamentally actually shift this for adolescents. So, and when we think about what that might mean for adolescents and for their development and for their well-being, it's important to keep in mind that these relationships, particularly relationships with parents and siblings, differ from relationships with friends and romantic partners in one really important way, which is the extent to which they're voluntary. So in general, relationships with parents and siblings are involuntary. You don't get to pick your parents and you don't get to pick your brothers and sisters. And no matter how badly it might be going, that person will always be your sibling or your parent. And you can't change that. But you can change your friends and your romantic partners. Those are freely chosen relationships for the most part. That is a person with whom the adolescent is choosing to spend time and to have a close and intimate and affective bond. And so those relationships are voluntary, and we're going to see that is actually a really key distinction. And that one of the things that is potentially challenging for adolescents about the pandemic is they may be having to spend increased amounts of time with the people they didn't pick. Right? So increased amounts of time with their parents and siblings rather than their friends and romantic partners. And as we'll talk about, that's going to be a risk for some adolescents probably, but actually potentially an opportunity in other cases. So we know that all relationships differ in terms of how good they are, in terms of the quality of those relationships. And we know that relationships differ both in terms of their positive features. So for example, how warm is the relationship? How much do the two people enjoy spending time together and doing things together? How close is it? How intimate? Is this a relationship where people engage in a lot of self-disclosure and really tell each other things they don't tell other people, and things that are very private and close to them. How fun is it? Is this a person you like spending time with? If you have something good happen to you, is this a person that you want to call because you know that they're going to be really excited about it too? So that we know that relationships can differ, and some relationships have more of these positive features and other relationships have less. We also know that relationships differ in terms of how negative they are, in terms of how often the two people are in conflict with each other, in terms of how often they fight, in terms of what those fights look like. So are they very destructive? Do those fights spread to include lots of different types of issues? Do they escalate up into verbal and physical aggression? So we know that relationships vary both in terms of how positive they are and how negative they are. And one of the things that I found really surprising when I first started doing work on adolescent relationships is positive and negative features are related to each other, but they're not the same. Or to think of it another way, they're not opposite ends of the same dimension. So on average, relationships that are more positive are also less negative. But we actually have to think of it as two independent dimensions. And we actually see relationships that exist in all four of these spaces. So for example, I think we're used to thinking about relationships that are high positive and low negative. So think about two best friends who are really close, they have lots of fun together, and they don't fight that often. And if they do, they work it out pretty quickly and they keep on being best friends, right? So that's pretty high positive and pretty low negative. We are also used to thinking about relationships that are low positive and high negative. So for anyone who's parenting more than one child, you may have experienced a sibling dynamic where it seems like all they do is scream and yell at each other. They fight all the time, and it doesn't seem like there's a lot of warmth or affection there, right? And so that relationship would be low positive and high negative. So when we think about relationships, I think we're used to thinking about those two quadrants. But you can also get relationships that are high positive and high negative. So you can get relationships that are very, what I'm going to call emotionally or affectively intense, where they spend a lot of time fighting and the fighting is very intense, but there's also a lot of warmth and affection and love there. And again, you can see siblings who very much fit this dimension. When they fight, it's nuclear, but there's also a lot of love and a lot of affection between the two people. You can also, especially for relationships that are involuntary, so especially when it's a person with whom you don't have a choice about being in this relationship, like with a parent or a sibling, you can get relationships that are disengaged. So relationships that are actually not very positive, but also not very negative. And so this actually comes up a fair amount for adolescent siblings who may have decided that they don't like each other very much. And the way that they deal with that is by never interacting. And so they don't actually fight anymore, but there's not anything positive really between them either. They're not engaging in this warmth, right? And so these are really, I think this is important to think about, particularly in the context of the pandemic, because you can't assume that a relationship that has lots of positive features is completely healthy, right? There are relationships that are very positive in some ways, but also feature a huge amount of destructive conflict. And so when we're thinking about adolescent relationships and when we're thinking about how the pandemic might be shaping their relationships, we always have to be thinking about both dimensions. You have to be thinking about how positive is this relationship and also how negative is this relationship. And don't make the assumption that just because it seems like a lot of positive things are going on, that there's no issue here, because that might not actually be the case. So let's take a look at some of the data that we've actually collected with Dr. Craig, and let's think about how is COVID-19 actually changing adolescents' relationships? And in particular, let's think about, is it changing with whom adolescents are interacting and how? And let's also think about, do adolescents perceive that their relationships have changed as a function of the pandemic? So if we ask them, do you feel like your relationships are getting better or getting worse? Do they actually perceive that things have changed for them in terms of their relationships since the start of the physical distancing? So this is data we collected with almost 900 adolescents, and we asked them about their relationships with their parents and their guardians, and with a sibling, and with a best friend. And we asked lots and lots of questions. The ones I'm going to focus on for today are, in a typical day, how much time did you spend interacting with this person, both before COVID-19 and after the start of the physical distancing? So again, we want to see, is there a change in with whom adolescents are spending their time since the physical distancing started? And then the second question is, how much do you think your relationship with this person has gotten better, and how much do you think it's gotten worse? And keep in mind that we asked both those questions. We asked both, did it get better and did it get worse? Because as I showed you, just because it got better in some ways doesn't mean it didn't also get worse in some ways. So we can't assume that because it got better, it didn't also get worse. So let's think first about with whom adolescents are spending their time. So this is showing you the percentage of adolescents who spent no time, 0 minutes a day, no time with their parents, their siblings, and their best friend, both before COVID-19 and after COVID-19. Okay, so what you can see pretty clearly from this is that the percentage of adolescents who are spending no time with their best friend has gone up, right? That makes sense because of physical distancing, right? So this is about time in person, and you probably shouldn't be hanging out with your best friend in person under physical distancing. So again, consistent with what Alexa showed you earlier, this is consistent with the idea that actually lots of adolescents are complying with these directives, and they're not spending time in person with their best friend. So give me 1 sec, because I got to move the chat box so I can see the rest of this figure. Here we go. So this is now showing you the percent of adolescents who are saying that they're spending more than 3 hours a day interacting in person, again, with a parent, with a sibling, and with their best friend before and after COVID-19. And what you can see is way more time with parents and with siblings after COVID-19. So far more adolescents are saying they're spending more than 3 hours a day talking to their parents and siblings after COVID-19. And we're seeing the decrease in the number of adolescents who are spending more than 3 hours a day in person with their best friend. And again, this makes sense, right? They're living with them, right? They're on lockdown. And so the amount of time they're spending with these people has really increased as a function of the pandemic. So this is very fundamentally changing with whom adolescents are spending their time. So just to show another example, we also asked about texting and chatting online. And the key thing to take from this is that if you look at the friends, the percentage of adolescents who reported that they were texting their best friend once or twice a day has gone down because, sorry, I've got the chat box over my slides here, because the percentage who have reported that they're chatting with or texting their best friend more than 20 times a day has gone up. So the in-person time with best friend has gone down, but the amount of time or the amount of interaction, texting or chatting online has gone up. Okay, so how do adolescents perceive? We can see that it's really changed who they're spending time with and the types of sort of the modality of their interactions. How are adolescents perceiving changes in their relationship? And so again, remember that we asked, how much do you think this is getting better? And how much do you think this is getting worse? And those are two separate questions. And so this figure, what we're showing you is that when we look at this, we can see that adolescents fall into 3 groups as a function of how they're perceiving changes in their relationships. So one group, and this is the group that's in this dashed black line at the bottom here, one group is seeing no change in their relationship. So 0 means no change and 8 means a lot of change. And this group is seeing really no change. We're only looking at parents and siblings here, but if we look at friends, the story is the same. They're seeing no change in their relationship. So it's basically the same now as it was before the pandemic started. A second group, which is this solid black line, what you can see when you look at this is they're seeing it's actually getting better. So they're reporting improvement, both in their relationship with their parents and their relationship with their siblings, and they're not actually seeing it as getting any worse. So they're actually reporting improvement in their relationships with parents and siblings. And then the third group, who is this solid gray line, perceives that their relationships are getting both better and getting worse. So they're seeing it's unstable. They're seeing a lot of change in their relationships, both potentially positive change. The relationship is improving some ways, but also negative, right? So it's also getting worse in some ways. And I know that I had trouble sort of getting my head around that the first time we saw it, but think back to the quadrants I showed you and think about that affectively intense quadrant. And I think this is what's happening, right? Is people, as they spend more time together, for some people, it's amplifying everything. So the things that are good might be getting better, but the things that were a problem may also be being exacerbated or getting worse. And again, we're only showing parents and siblings here, but if we include friends, we see the same pattern, where for some people, they see it as no change, some people see improvement, and some people see that it's both getting better and getting worse. So what might this mean? One of the things that was really interesting to us is that it was actually perceptions of stability were associated with the best mental health outcomes for youth. So youth who saw their relationships as staying the same. Oh, I just got very loud there. Youth who saw their relationships as staying the same, so not getting better, but not getting worse, had the lowest levels of internalizing symptoms. So the lowest reported, self-reported anxiety and depression, and also the lowest marijuana use. They also were the most likely to be sexual minorities. Youth who saw their relationships as getting better, so youth who said that things are actually getting a little bit better, were actually in the middle of the three groups in terms of their internalizing symptoms and their marijuana use. So they actually were showing greater anxiety, reporting greater anxiety and depression and greater marijuana use than was this group that stayed stable, even though they were reporting improvement. And this was also the group that had the lowest family affluence. And then finally, the group who saw their relationships as getting better and worse. So again, the group who saw their relationships as unstable, they were perceiving a significant amount of change in their relationships with their parents and their siblings. They had the poorest mental health based on the information we collected. So they had the highest levels of anxiety and depression and the highest level of marijuana use. Interestingly, they had the highest family affluence, and they were living in the provinces with the highest rates of COVID-19, which probably means that they were living under the most restrictive measures. So they probably were spending more time and under more pressure to not interact outside of their house. So they may actually have experienced the most actual change in their interaction patterns because they were under the most restrictive COVID-19 rules. So we're just gonna wrap up, and then we're excited to take questions with some recommendations for parents and for educators that sort of we took when we looked at these data. So for me, one really important thing to be thinking about is that it's critically important that we're supporting youth in their relationships with their parents and their siblings at this time. So youth are spending, we know this, increased time with their parents and their siblings. And again, these are not relationships that they have necessarily chosen. Some youth would freely choose to hang out with their parents and their siblings, and that's great. But that's not true for everybody. But now they're stuck in a way that they have historically never been stuck before, right? You can't just be like, I don't want to be here and I'm leaving. And so that I think is really interesting because it presents real risk for a lot of adolescents that I think we need to take very seriously. But as I said, I think for some people, it may actually present a potential opportunity. So to think that through, let's go back. As an academic, I love quadrants, so I will never miss an opportunity to make people look at my quadrants. But I think it's helpful here to think about who might be at greater risk and who might, and where we, that in this pandemic, everyone is not equally vulnerable. Some people are at much greater risk and may be more likely to suffer mental health consequences than are others. And that's really true if we're thinking about the kinds of relationships that adolescents had with their parents and their siblings before the pandemic started. So adolescents who, before the pandemic started, were in this quadrant with a parent or with a sibling, so low positive and high negative, I think they're really vulnerable right now, because those negative features are probably going to get amplified in these circumstances when they don't have an option to go somewhere else or to get a break or to get support from an outside person. So these are the in terms of their relationships, these are the adolescents I'm most worried about. And I think we need to think about how we can support them. So in the case of, you know, an adolescent who has a very highly conflictual relationship with a parent, we need to be thinking, I think, about how we can connect them to other mentors and to other supports, because they won't have it naturally in the way that they might under typical circumstances, because they may have supports at school that they may not be able to access now. And so I think we need to think about how can we get those kinds of supports to adolescents who might have a very negative relationship with one or both of their parents. I'm also going to take a minute here to plead with people to pay attention to sibling relationships. So sibling relationships, of all the relationships that kids have, sibling relationships are the ones that people don't pay attention to, including researchers. We know the least about sibling relationships of any of kids' relationships. And sibling aggression in particular, people haven't paid much attention to because they think it's a normative rite of passage and that's just how siblings are and they'll grow out of it. But it's increasingly clear that aggression that happens between siblings can have significant long-lasting consequences on children's mental health. And again, under these circumstances where you may not be able to get away, and you may have to navigate in this circumstance, right, in shared space and with potentially limited resources, this is potentially going to be a powder keg for sibling aggression. And so I really would encourage people to pay attention to what's going on between siblings and to step in and to intervene when aggression between siblings is happening. It is common. It is the relationship that is most likely to escalate to violence for kids, but that doesn't mean it's not harmful. It can be. So I'm worried about these kids. I think this represents a real possibility of risk. The disengaged relationships, though, I think potentially might be an opportunity, because this is a place where potentially, if the negative features aren't that high, what we could potentially focus on here is dialing up the positive features. And this may be an opportunity to do that, because again, they're going to be spending time with their siblings. And so can we think about providing support around building a stronger and more affectively positive, a warmer sibling relationship? And so I think when we're thinking about supporting healthy relationships, we obviously want to be thinking about reducing negative features and reducing conflict and fighting for kids who are experiencing that, but also potentially an opportunity to build on strengths and to think about increasing the positive features that are present in relationships. So another thing that we wanted to highlight here, and this is something that I found really interesting when I looked at these data, is perceived instability of relationships may be a risk marker. So I will not lie to you, I was really surprised by what we found. I assumed we were going to get a group who said everything was getting worse. That, especially with parents and siblings in an involuntary relationship, when you have to stay home with the people you maybe didn't pick, I assumed that there were going to be a group of kids who were like, no, this is bad. Like everything is deteriorating. And we didn't find that. But what we found is that when adolescents are reporting change, their mental health looks poorer than the adolescents who are reporting stability, even when that change is reported to be positive change. And so I think this comes back to this idea that we talked about, which is positive and negative are not opposite ends, and things might be improving in some way and getting worse in others. And that if you're hearing about significant upheaval or significant change, or that things feel really different now, even when a lot of that change seems like it's positive, you may want to dig a little bit and find out what else is going on, because that perception that things are really changing may indicate that in some ways things are actually getting tougher, or there are challenges in other ways. And the last thing that we wanted to highlight is that at this time, it's going to be really important to keep reaching out to adolescents through multiple modalities. So lots of different ways of reaching out and lots of different approaches in terms of encouraging guidelines to for COVID prevention and adherence to those guidelines. We also want to, keep in mind that, adolescents are at home now, and they may not have a lot of privacy, right? So this is a real challenge that we've gone through working clinically with adolescents, is that they can't come into our offices, and when they're at home, it may be difficult for them to have a session when nobody can hear them, right? And they may not be able to talk, or may not want to talk, if they think that a parent or a sibling is around and listening. So thinking about text-based support and text-based programs may be really helpful at this time as a way of connecting to and supporting adolescents, or also using like DMs or chats on the computer, so that they have a way of reaching out and getting support that may feel more private during a time when I think privacy may be in short supply. So that's what we wanted to say. So thank you very much for your attention. And as I said, we're very excited to take your questions and to hear what you're thinking about. And I'm going to attempt to unshare my screen. Here we go.
Well, thank you both for that very informative and thoughtful presentation. Really great to hear some of those results. Some questions did come through in the chat, so maybe there's one or two that's just a clarification, so we'll just go. So there's a question about, I'm sorry if I missed this, when you said after COVID, does that mean after lockdown measures have been lifted?
Oh, sorry, I think that's Alexa.
No, so I guess we meant sort of after the COVID lockdown. So we, because when the COVID lockdown ended, has varied so much from region to region and province to province, we didn't try to look at sort of differences in when the COVID, so we're really thinking of it as before the COVID-19 lockdown and then after, and not really taking into consideration variation and change in lockdown afterwards. But yeah, I think that's something that we really are going to need to incorporate in terms of looking at this going forward. That's a really good point.
So we meant before COVID-19 started and then after the start of the physical distancing measures.
Yeah.
Because everybody kind of started at the same time. There's been change after that, but everybody kind of went into lockdown at around the same time.
Okay, so another question was asked about, are any adolescents losing contact with friends/romantic partner during the pandemic, becoming withdrawn?
So, Melanie, do you want to start with that, or?
So I think that certainly will be the case for some people, although again, kind of normatively, or sort of if we look across like the big group of adolescents in the sample, what we're seeing is they are increasing the amount that they're texting, right? So the in-person contact has come down probably because of the lockdowns, but they are texting and that's increasing. So one of the things that will be really interesting, so we're collecting follow-up data with these adolescents, and one of the things that will be really interesting to see is that happening? So are we seeing, for example, that for some people, romantic relationships are breaking up or friendships are ending because they're not able to interact in the same way? So I think that's a very likely possibility for some people, and we will know more about that when we can see when we can look at follow-up data and know what's happened over time.
Yeah, and we also have some information about feelings of loneliness, so I think that's also something that we're planning on looking on next, because I think for a lot of youth, they're going to be experiencing a lot of loneliness when they can't be around their friends or their classmates.
I'll just pipe in too, because we also are collecting daily diary measures. So we have, we'll also collect that every day for 2 weeks on a subsample of them. So yeah, stay tuned. Sorry, couldn't resist.
No, please.
Okay, another question. Did you look at the relationship between adolescent texting behaviors and their feelings about their relationships?
We could.
That's a really, we do have information about their texting. The one thing that really, so we looked at how the amount of time they spent sort of online and offline with their parents and siblings and friends and romantic partners. And the thing that I think that was most striking in terms of when I was looking at the data is that while we tend to think of higher levels of communication as being positive between parents and children, there was definitely an association between post-lockdown higher levels of online interaction between parents and children and poor outcomes and poor relationship quality. So I think that that's a really interesting question, but I also think that you see especially with adolescents, if you're all in the same house together and you're texting each other a lot, that might be an indication that perhaps in-person levels of in-person communication is sort of broken down. But yeah, I think that there's going to be we have a lot of information on texting, and I think that's going to be something that's going to be really important to dig into.
Yeah, so if you're living in the same house and you're choosing to text rather than to interact face-to-face, that seems like it's a marker that there's problems.
Mm-hmm.
Okay, did you question the impact of COVID-19 on bullying by peers? Do you think that bullying has reduced due to the absence of physical contact, or on the contrary, has cyberbullying increased?
I wish Brett was here.
I can answer that from another study.
Yeah, so I was going to say, so I'll give you the short answer from this study, which is we need the longitudinal data to know if that's changing. So that is a very reasonable hypothesis that we might see an increase in cyber victimization because everyone has sort of migrated online. But the data we have wouldn't answer it, but it sounds like Wendy has secret data. Right?
We have another data set that's nationally representative, and we find that both the cyberbullying and cyber victimization has increased about threefold.
Oh.
Yeah.
That's not a happy story.
No. Okay. Did you find any gender differences in this project?
So that's a good question. In terms of looking at the ways in which youth are perceiving change in their romantic relationship, that's the main place where I've sort of we've looked at gender so far, and you do see higher. The group that reported high improvement and high worsening were more likely to be girls, and we're also more likely to report gender minority identities. So we're seeing a bit of we're seeing some gender differences there, and that's something that we're going to have to dig into a little bit more as we move forward with this project. But yeah, because I think there are some important gender differences in terms of how youth are experiencing the COVID-19 pandemic.
Okay. Have you looked at what the adolescents are doing to keep busy during the confinement? Great question.
In this data set, we don't have so much of a
texting.
A day in, day out.
They're texting a lot.
Yeah.
It's a lot of texting.
There are other studies that are showing a lot more screen time, a lot less physical activity time, and less behavior that we might be interested in seeing. So, for example, less substance use. But yeah, we can't speak to that specific question during with this data, unfortunately. But we probably will with the daily diary a little bit more.
Okay. Could you comment on the impact of COVID-19 and safety measures imposed, e.g., lockdown, on Indigenous adolescents? How would it differ from other minority youth?
I think that's a really important question, and there's an article that I read about the impact of the lockdown on Indigenous youth in Canada in particular that I can send to Wendy and she can put up on the PREVNet website, because I thought that was really helpful. But in the lockdown, that article talked a lot about particularly community differences in community access in terms of internet access. So a lot of Indigenous communities are underserved in terms of how like the speed and quality of internet. And so that's a big thing, especially as schooling moves online for Indigenous youth. And then any other exacerbating factors, so income inequality, experiences of over-policing, those are all disproportionately going to impact Indigenous youth compared to other youth when we think about the consequences of the COVID-19 lockdown. But so that's what I've read about it so far, but I think there's a lot more research to do in that area.
Okay, thank you for that. That's all I see in the chat box. Does anybody want to unmic and ask? Or I don't know if Stacy will let you unmic. Or any other questions in the chat box? I'm just giving them a minute in case they're as bad a typer as I am. Okay, well, having seen no other questions, again, I want to just say thank you to our two presenters. I want to remind you that there is a link that Stacy's going to put in the chat box for your evaluation, and you can get your certificate of attendance. And I also am very grateful and learned more every time I listen to the two of you speak. So thank you for that. And we will be posting this webinar, and as well, we'll share that article that people were interested in about Indigenous youth. So thanks again, and much appreciated for your work.
Thank you for having us.